Hi, I'm Lenore Arab. I'm sure that John Adams already introduced me, and I wish I could be with you in person, but I am in northern India on a prior commitment and did not want to miss the opportunity to give you an introduction a little bit to our rapid response team, but more importantly, to a funding set of opportunities that are very new and exciting and revolutionary, the PCORI opportunities. So this rapid response team, to begin with, is a component of our CTSI that is designed to help investigators put together grants, and I will introduce you to the team. I direct the unit. The Director of Operations is with you here, Robin Faria, and she will be here live to answer your questions. I hope I don't leave too many questions, but I hope I do leave you with enthusiasm about this opportunity. And we have two other team members, a scientific coordinator, Alice, and our administrative coordinator, Jane, both of which are well known and much loved by the growing faculty and administrators that have been interacting with our team. We're under the Dean's office, the Associate Dean of Research, Dr. Judy Gasson, and the head of the CTSI, Dr. Steve Dubonnet. And you can find out more of our group by contacting us. I want to tell you, however, what the realm is of options in terms of what we provide. So in prior work of mine, I was asked to, in internal medicine, come up with solutions on how we could have better success with our grant funding opportunities. And we found out, I and the committee that I was on, that there are a number of things that could greatly be enhanced. One is the timing, the awareness of potential funding opportunities, then getting the right people together to prepare that grant. Very important early on, make sure that the proposal or the specific aims of that proposal actually are responsive to the call for proposals. Then there's all that work in the middle, what I call the 83 moving parts in developing a grant, and the timeline that if there's a great attention to it and the grant is prepared in a timely fashion, it will go out the door with external review and have a much greater chance of success. We also try to facilitate mock reviews by internal and or external reviewers, and then if you don't make it the first time, we help with revision and resubmission of proposals that are out there. We have actually developed software that is supporting the many pieces of grant development, and this grant proposal management software provides all kinds of things. You'll see it on this slide: grant time management, helpful reminders, a number of reports. There are task notifications for the different team members on the grant. It provides opportunities for securely sharing documents instead of looking through your email to find out when the most recent version of a narrative or a revised set of aims is. There's some technical support and document tracking that is supported by our software. This isn't my main topic today, but I wanted you to know that that's out there and you can contact our team. We will set anyone up with the software if you're interested in it. And we offer various levels of support light, but for large grants, team science, we get much more engaged in many, many other aspects of the study. But today's topic is about PCORI, and just a little while ago, on September 22nd, PCORI actually came out to California, held a meeting in San Diego to give us all the latest update on where they're going, how they've changed, what the opportunities are, and what they are looking for. So I'm going to share with you some of their slides and tell you that I have been a reviewer for multiple rounds of PCORI, I think every round of PCORI funding thus far, and can give you a little bit of an insider's view of what we're looking for when we're reviewing these proposals. We also have a very extensive set of slide decks from this meeting, and if you contact the RRT, we will provide you access to them. So first of all, what is PCORI? PCORI is a patient-centered outcome research institute that is to assist patients and clinicians, policymakers, and others in making informed health decisions. And it was funded by the Patient Protection and Affordable Care Act to be an organization that is outside of government so that it is not unduly biased by politics of the moment. Their mission is, as this independent nonprofit, to help improve decision-making and options for in the realm of clinical care. So it's not an NIH. It is really a patient-focused, stakeholder-focused approach to doing things like comparative effectiveness research. And their strategic goals, as you'll see on this slide, are to increase the quantity, quality, and timelessness of research, the timeliness of research information, speed the implementation, which is now abysmally slow, new findings, and influence the research funded by others. So they have a number of national priorities that they have developed over time, and their funding opportunities are linked to each of these: improving the healthcare system, addressing disparities, communications and dissemination research, that's the study section that I am on, and assessment of prevention, diagnosis, treatment. And then there is a whole component of PCORI that addresses methodology and the methodologies that we need and have been lacking to do this job. They have finally filled out and flushed out who their program directors are, and you're seeing a picture of them here. And Jean Slutsky has recently stepped in as the head of communications and dissemination. She comes from our HSR world. Every proposal in PCORI has to address these questions, the patient's questions. The questions which include given this new information that I am confronted with a disease, what should I expect? What will happen to me? What are my options? What are the potential benefits and harm of these options tailored to my particular situation, be it gender, age, ethnicity, opportunities to access health care? What can be done to improve? What can I do to improve the outcomes? And how can clinicians and healthcare delivery systems be improved to make my interests improved? So the outcomes are not clinical outcomes. The outcomes are not scientific outcomes. The outcomes in PCORI are the outcomes that the patients feel are most important. PCORI is really serious about authentic stakeholder engagement. They want engaged stakeholders at every step. They want the stakeholders to say what should be studied. They want them reviewing proposals. They want them authentically partnered in the research. They want them to be involved in dissemination and implementation, and they want them to be evaluating how this institution, PCORI, is actually doing. And this is something very new. This is what is revolutionary about this research opportunity. Changing the way we think, changing the way we write grants, changing the way we have leadership and involvement in the progress of grants. And it doesn't apply only to PCORI now. NIH seems to be increasingly involved in doing patient-centered research. So even if you're not going to be interested in PCORI funding, it behooves you to pay attention to this trend, which I don't think is going to go away anytime soon. Now, since engagement is so new and so different, they have some tools, including engagement officers, that are there to help awardees to outline their milestones. They also have rubrics that can put a little more in your direct line of vision what they mean in every stage of a research development, defining the hypothesis, in patient involvement in what the measurements will be, what the intervention will be, what the outcomes will be. And I don't have the time today to get into that in more detail, but ask Robin about the rubric and she can direct you to it. We actually often hold a presentation on that entire rubric. They have a number of engagement resources, and if you get the slide deck, you'll be able to link directly to them. Now, PCORI has funded already 313 projects throughout the country. That has been to date a total of approximately $550 million in awarded research, and they've been touched down in 38 states already in the District of Columbia. They also do some awards outside of the country. One has gone to Canada thus far. You'll see here what the geographic distribution of the funding is. In the West, we have gotten 17% of the funding distributed thus far, and about 48 of the total awardees. They do take great pains to distribute the funding in geographic ways, ethnic ways, and across disease categories, although in principle they are disease agnostic. PCORI has also shown us what they have done in terms of their funded projects to date by disease category and by population studied. And you can see this on the slide that cardiovascular disease is number one. However, they have already funded 32 projects in cancer, and they are interested in some rare diseases as well. You'll also see they're very interested in spreading the portfolio across ethnicities, age, and rural and urban populations, and other such aspects. So what's the success rate with PCORI funding? You may hear from people that PCORI isn't a lot of money, you have to perform very quickly, and the success rate is very low. Here you'll see, compared to NIH, actually, it's almost about the same currently. They started off with a 13% funding rate. They were slow in getting started and determining where they wanted to put their funds and putting out the RFAs and getting the right people responding in an appropriate way. We saw that very intensely in the study sections. And now in the later cycles, we're seeing a 11, 12% rate of funding. It's actually at 10 at the last round, but the resubmission rate, a success rate, is as high as 15 to 30, 28%. So how much money do they have? They are not slim pickings. PCORI is going to distribute $661 million in 2015 for a number of different research areas, and they reported at their last Board of Governor meetings that $475 million of that will be research awards, $165 million will be infrastructure awards, and there will be $21 million in engagement and pipeline awards. These are much smaller awards, but they might be particularly interesting to you because they help one get started. So what are these pipeline to proposal awards? They actually are tiered awards where if you're totally at the start of trying to figure out how you're going to get stakeholder engagement, you could request a Tier 1 award to build community and capacity around a topic of interest to patients, because you cannot go into PCORI saying, I have this great idea, I know exactly what is necessary. The patients have to deliver the question. They have to be behind it, and it has to be a project that is yours in a greater group and not yours in the singular. So much so that when I see letters of support where some patient is saying, I'm very happy to help Dr. Arab with her proposal, I would nix it because it shouldn't be her proposal, it should be our proposal. Tier 2 is for formalizing partnerships. Tier 3 is for actually creating the research proposal, and sometimes that would be useful if you have been rejected the first time around. Now you'll see here the amounts that are in there. These are small amounts, $15K for Tier 1, up to $25K for Tier 2, up to $50K for Tier 3, and these are short 9-month to 12-month grants that are supposed to help launch you into a successful PCORI undertaking. Tier 1 funding is only beginning now. It's beginning in the fall of 2014, and these awards will be available through 4 regional offices. I'm expecting that we'll be seeing an awful lot of these submitted. Now, there are other PCORI opportunities coming up in the spring. We want you to know, usually they deliver an RFA, and shortly afterwards expect a letter of intent. That letter of intent is competitive. You will be rejected from this letter of intent if it does not truly meet what the scientific staff at PCORI considers their main interest area and a true PCORI proposal. The next due dates for these letters of intent are in March, and notice for each letter of intent, the application date is very shortly afterwards. You have 2 months to put it together. That is not much time for a truly authentic engagement proposal that involves numerous partners and is going to provide preliminary data and have a very solid design. So you'll be able to take a look at this more closely. I'm just going to point out the amount of money that they have in each of these areas. They have appropriated from $8 million for disparities, $12 million for the improving methods, and $32 million for prevention, diagnosis, and treatment of disease. These are usually 3-year projects. PCORI's in a hurry. They are only going to be legislatively alive for another 5 years unless they are renewed, and they need to show that they've made a difference. So they want projects that can make a huge difference in a short period of time. That means you don't go into PCORI with a dream of something you'd like to do. You go into PCORI with preliminary data, an approach, an intervention that is effective, and you're testing it against other interventions in that clinical system to see if it outperforms them, to see if it is feasible, to see if it is acceptable. This slide is to show you what it takes to put together a PCORI proposal. So the research strategy is about 20 pages long. You need to put a dissemination and implementation potential piece in there as well. We are glad to help direct you about with regard to your dissemination and implementation. You have to talk about reproducibility and data sharing, protection of human subjects, of course. There will be contractual arrangements and agreements. You can only have a maximum of 10 pages for references and appendices, also 10 pages. We expect at PCORI letters of support from all partners that are not copycat of one another, that truly are presenting what that individual brings to the table and why they're interested in supporting it and how much support they're willing to give. Along the same lines, the expectation is that your stakeholders will financially be as involved in the budget of the study as will the traditional scientific investigators. Okay, there is also the usual environment, performance site, and resources part that's needed. Let me tell you how we review proposals at PCORI. So the review criteria are 5 areas. Used to be 8, it's changed, it's down to 5. One is impact. How important is the condition that you're talking about, and how much will your success impact that importance? The second one is the potential for improving care and outcomes. What can actually be done, realized, implemented more broadly across the country? Technical merit is always in there. They're not going to put money in something that is not technically strong, including use of the methodology that they have approved and put out there. And so there is a methodology report. If you can find it on their website. If you need help with interpreting it, you can contact us as well. The patient-centeredness of the proposal involves things like how much did patients play a role in developing the proposal, how much are they truly their outcomes. But then there is another whole category for patient and stakeholder engagement, and that is, what are they doing on the ground? How are you in a leadership collaboration with them? How are they engaged in actually implementing the study, evaluating the study, and pursuing the study? The scoring is just like NIH scoring. It's a 1 to 9 scoring. I like the additional guidance terms better than the numbers. For example, if you have a strong proposal, but there's at least one moderate weakness, you only get a 5. You have to be extremely strong with negligible weaknesses to have an outstanding proposal. I don't know if I've ever seen a proposal that scored around 1s. Most of them fall into the middle category because there are not that many true PCORI proposals that have been in circulation yet. So what happens is, within the study section, everyone scores the grant. The primary reviewer scored on all of these areas. The others give it an overall impact score. The discussed proposals have an averaged overall impact score, which is average to 1 decimal point multiplied by 10. So the scores range from 10 to 90, 10 being the best score. Now, they're evaluated in about 10 to 15 minutes. There are 4 reviewers. A scientific reviewer starts off the discussion briefly with 2 minutes of summarization of what is going to be going on there. Then there's a stakeholder giving their point of view on the proposal, and then there's about a minute each for the other 2 scientific reviewers. There are a number of new areas, and I don't want to emphasize this too much because they change all the time. So you can look at their website, you can revisit our slides on this, but there are certain areas of interest they are particularly interested in, and it's really important to look at what they no longer are interested in, such as promise projects or systematic reviews or the like. They have revised and will continue to revise their research priorities as they flush out a portfolio and say, we've done enough decision-making tools, we're not going to fund any more apps in individual levels in rural communities, this type of things. Decision-making guides are less interesting now than they were initially because they've gotten flooded with opportunities there. So let me just encourage you by saying we have gotten PCORI awards at UCLA. The very first one was actually by a fellow in internal medicine, Robin Clark, received a pilot project funding award among the very first rounds of awards in 2012. And he is involved in a Delphi approach to defining patient-centered community health centers. Ken Wells has received a very large award for addressing disparities, looking at the long-term outcomes of community engagement to address depression and disparities in that. He also received that award in 2012. In 2013, there was an award to look at telehealth that Tumeni Kokargant, at telehealth to deliver mental health support and behavioral services in primary care settings for children in underserved areas. And she was invited to speak at the San Diego meeting, demonstrating examples of true stakeholder engagement. David Rubin also received a PCORI award to understand patient-centered outcomes for dementia. And so basically in every round of funding, we have had one proposal that has been funded. Bill McCarthy received one in the nutritional area, looking at 2 government programs, My Plate, and other opportunities for trying to get people to have improved nutritional status and weight loss. So I'm just going to conclude by saying, and trying to encourage you by saying that PCORI is a big funding opportunity right now if you're doing the type of research that they want. Your research has to be shovel ready. It has to be ready so that you can show results in a year. I want to point out that very diverse faculty have received funding. It isn't something that's only reserved for the old guys. Fellows to full professors have gotten PCORI funding. And we have been at the heart of it since the start and would be glad to assist you in finding the appropriateness of this funding. So if you would like to do that, here's our contact information, and I'll turn this over to Robin Faria to address your further questions. It's been a pleasure talking with you. I hope to see you in person.